to the channel, please click on Dr. Sticky Notes and get subscribed to the channel so you can access numerous videos which are less than 5 minutes. At least see one video per day. I have also created playlist for each and every subjects, so get benefited. All the best guys. Good evening guys, welcome to today's video. In this video we are going to see the most important topic which is often asked in INICET and NEET PG examinations. Yes, these are the types of wound based upon the classification of surgical wounds. Yes, there are about 4 classes. I will be writing only keywords, but I will explain with examples. So please concentrate. Okay, there are class 1, class 2, class 3 and class 4. Class 1 wounds are nothing but clean wounds. Class 2 wounds are clean contaminated wound. And class 3 wounds are contaminated wounds. And class 4 wounds are dirty infected wounds. Yes, what are those clean wounds? That is class 1. This includes those in which no infection is present. Only skin microflora is potentially contaminate the wound. Okay. No hollow viscous is entered here. No inflammation. If the wound which has all these explained categories, it will be coming under clean wound. I will explain it again. Clean wound or the class 1 or includes those wounds in which there is no present infection. There will be no present infection. Only skin microflora potentially could contaminate in the future. Okay, there will be no present infection. Also, there will be no hollow viscous entry. There will be no inflammation in class 1 wound, that is clean wound. Keep that in mind. What can be the example of class 1? Hernia repair. Also, breast biopsy. Okay, what can be the explanation of clean contaminated wound, that is class 2? This wound includes in which hollow viscous such as respiratory tract, alimentary tract and even genitourinary tract with indigenous bacterial flora is opened but under controlled circumstances. Okay, without any spillage of contents. It's nothing but opening, that is opening or reaching the hollow viscous organs such as respiratory, alimentary, that is GIT tract and genitourinary tract, which has their own indigenous bacterial flora, that is opened but under the controlled circumstances without any spillage of contents. Here also there will be no inflammation. So what can be the example of this? Elective GI surgery. Also cholecystectomy. These questions can be asked as match the following type of questions with examples. So concentrate with the explanation so that you could understand. Here comes the class 3. Class 3 are nothing but contaminated wounds. What can be the explanation here? These are nothing but the open accidental wound encountered early after the injury. So there will be an extensive introduction of bacteria from outside into the sterile area of the body. So there will be introduction of the microbes due to the major break in the sterile techniques. Or there will be also an uncontrolled spillage of viscous contents from the intestines, etc. There will also be an inflammation which is very apparent here. So with the example you can relate the explanation. Yes, what can be the example? Penetrating trauma, that is penetrating abdominal trauma like stab injury. Any large tissue injury or enterotomy during bowel obstructions. These can be explained in contaminated wound, that is class 3. I will explain it again. Class 3 is nothing but you are exposing an open accidental wound that is encountered with an extensive introductions of bacteria from outside into the normal sterile area of the body. Okay, there will be also the break of sterile technique, or also in the case of uncontrolled spilling of contents from the hollow viscous organs or from the viscous contents from the intestines. In class 3, inflammation is apparent. Okay, now coming to class 4 or dirty infected wound. Dirty infected wound includes those traumatic wound with delay in the treatment. They will come to the hospital very late. That has been occurred. So the patient will be presenting with the necrotic tissues, with full of inflammations like that, contamination like that, which includes the wound in which pus is also present. Severe inflammation is seen in this case. Example, perforated diverticulitis, also necrotizing soft tissue infections. It also includes incision and drainage of abscess. Okay guys, I wrote everything in a shortcut form because I have to contain the content in the sticky notes. So whatever I have said, please get into your mind and write the sticky notes in your own handwriting. Paste it on a wall sheet on daily basis. See you in next video. Until then, peace.